To Pediatrics by Dr. Anand. This is the beautiful Unacademy platform where we share some immense amount of beautiful knowledge. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Good evening to all the beautiful people, all the beautiful crowd. Yes, I think it's audible. Sab log aa gaye. Let's start this class. My name is Dr. Anand, Assistant Professor in a medical college. Hi, Dr. Osama, Swaraj, Suman, Anvesha, beautiful Sahil, Kavya, so many people. Meta Zillo, beautiful people. Very nicely, you guys. We all are one family. And one thing I have always taught you, that be strong, be amazing, be perfect, be the best version of who you are. Every day, try to improve yourself and just be amazing. Okay? Yes, let's start this beautiful class. Unacademy is a platform which helps us out to be together, to share some beautiful amount of knowledge. The price of Unacademy is going very high, as it has already gone now. 20% rise has been after the 8th June. I hope you guys have taken Unacademy. On this beautiful platform, we have the batches for 2023 NEET PG, which basically has a module-wise batch, 6 months and 3 months batch with the beautiful, amazing educators. In the Unacademy, we also have a batch for NEET PG 2023 discussion batch for the previous year students. In the Unacademy, many of us are applying for UPSC exam, and we have this 1 month and 2 month beautiful prize for the beautiful students who are applying for UPSC. For the light-hearted students, we have this beautiful Unacademy Light Pack, which basically has the previous year question papers and the subject-wise test series. As I have told you regarding the Plus subscription, Iconic subscription, Light subscription, MBBS subscription, and also you have the UPSC subscription. The plans are amazing. The price is so beautiful, and if you want, you can take it. Let's start this beautiful class. Today's topic of choice is the continuation of neonatal resuscitation protocol. This is the part number 11. This month I'm going to cover full series of neonatology and other systems also. Jitna zyada ho paye, we will try to cover in this month. Before starting any amazing segment, we always have a motivating quote, and today's motivating quote says, always trust your gut. Always trust your gut. It knows what your head has not yet figured out. Very nice and very strong quote, right? Exactly. You know, like we always say, right, that I don't think so I'll clear this exam, but I have this gut feeling that I will rock it. I have this gut feeling, you know, we have this gut feeling, I think I can do it. I'm not sure of whether I can do it or not, but I have this gut feeling that I can do it. So sometimes when your head doesn't know, your gut feeling knows. So it's a very beautiful quote, and that's very well true also. Sometimes in life, we say, no, that gut feeling here that I think I can do it. I don't know whether I'll get marks, but I have this gut feeling that I will rock the paper or I will be amazing in my life. So gut feeling really plays a very important role. Always trust your gut. It knows what your head hasn't yet figured out, right? Exactly. Good evening, Dr. Shubhangi. We have Shibham Day. We have our शुभम आई एम गुड ब्रो. मैंने फोटो पोस्ट किया, तूने देखा तूने फोटो जिम वाला. ओके. या डॉक्टर, वी हैव अ आईडी हु सेज, सर कैन आई बाय BMW like you with psychiatry? Undoubtedly bro, you can. Psychiatrists are making huge amount of money. You know that, right? 1 in 3 people, 1 in 3 is suffering from depression. In every family we have one person who is facing depression. So if you are a psychiatrist, will be millionaire. But the only thing is, you have to be good at your job. Okay, you have to be good at your job. Success will come, money will come. If you're good at your job, money will come. So don't run behind money, don't run behind wanting to get rich. Just be good at your job. If you are good at your job, people are gonna come to you. It's as simple as that. Okay, neonatal resuscitation we have already covered. I will ask you only the questions which we have not covered. Let's be ready to answer amazing questions. Yes. My first question, quickly tell me, very quickly, please tell me, if the baby is crying immediately after birth, the best answer is dash. What should I do? So the answer is, yes, everyone knows about it. Yes, the answer is nothing but routine care, right? Routine care. If the baby crying immediately, routine care. If The baby not crying immediately after birth, what do you want to do? Yes, exactly. You will do initial steps. What are the initial steps? Position, suction, stimulation, and reposition. Suction the mouth followed by the nose. This part is also over. Now this is question number 1, which we have not told in the previous class. The size of the suction catheter. Can anyone please tell me what is the size of the suction catheter? Today only in my medical college, I was taking classes for final year MBBS students. We had an instruments class today, and I told them suction catheter. Can you please tell me what is the rough size of a suction catheter? Yes, roughly around 12 to 14 French. F is the French. 12 to 14 French. There are various size of suction catheter, even numbers we have 8 French, 10 French, 12 French, 14 French. According to the books, 12 to 14 French is what we usually have this one, the size of the suction catheter. Very important, suction pressure. Suction pressure is also very important. जो होता है ना, I'll show you a machine. Okay, 1 second. ये yeah.
Hello everyone, welcome to Pediatrics by Dr. Anand. So today's,
can you see this one? Now see the video. Okay, behind, can you see a yellow color machine? This one. Can you see that, bro? This one. Can we appreciate this one? Yes, exactly. What is this? This only is the suction, like the suction machine, basically suction machine. A suction machine may usually we have the yahan pe na, see this one. Okay, I have this thing, round thing, where I can increase or decrease the suction catheter pressure, suction machine pressure. Are you understanding? Yes or no? Okay, if I am a gynecologist, I want to do a forceps delivery, I will increase the suction pressure. And in normally suctioning a newborn baby, can anyone tell me how much the pressure should be? Anyone? What is the normal suction pressure in our for the newborn baby suctioning the mouth and the nose? Kaun batayega? Hanji, very good. Yes, Suman, Sahil. It's so nice. I'm in labor room. This one video, I like it. Bada maza aata hai. The beautiful answer for this question is 80 millimeter of mercury or 100 centimeter of water. That is the beautiful answer of the suction pressure. In this slide, in this video, we're going to talk about the new questions, not the previous one. In the last video, neonatal resuscitation MCQs are done. Akanksha, my day was fine, dear. How was your day, Akanksha? Please let me know. Also, this part is over. Let me ask you something important. Okay, listen very carefully. See, if the baby, see, 3 things we understood. Do you remember? Heart rate less than 100. What do you want to do? Bag and mask ventilation, right? Heart rate less than 60. What do you want to do? Bag and mask ventilation and chest compressions. Now the extra point which I want you guys to know, if the heart rate was less than 100, obviously bag and mask ventilation you will do. Now please write update in your notes. You will also put a SpO2 monitor and an ECG monitor in the baby. Okay, SpO2 monitor and ECG monitor also you will put in the baby if the heart rate is less than 100. And same if the heart rate is more than 100. What is the normal heart rate of a newborn? Who will tell me? Yes, the normal heart rate of a newborn is 120 to 160 beats per minute. I am saying if the baby's heart rate is more than 100, what do you want to do? You will do the initial steps again, which is nothing but position, suction, stimulation, and reposition. If the heart rate is more than 100, do you want to do bag and mask ventilation? No. Bag and mask you will only touch when the heart rate is less than 100. Should I do chest compression in heart rate more than 100? No. Chest compression you will only touch when the heart rate is less than 60. So what about heart rate more than 100? Nothing, just little position, suction, stimulation, reposition. That you do, baby will be fine. And same thing only, connect a SpO2 monitor. It will be fine. Okay, next point. This part is over. Yes, the ratio of chest compression to bag and mask, I told you it is 3:1. And for infant guys, can you please tell me now, for the infant kitna hum rakhte hain roughly chest compressions to bag and mask ventilation? In the evening class we did that, yes or no? Exactly. Yeah, Shubhangi Kaushik is perfectly right. Yeah, 15:2 is the beautiful answer. 15 compressions and 2 bag and mass ventilation. And as Dr. Shubham told in the evening, how much chest should be compressed? Obviously, 1/3 of the chest definitely should be compressed. This part I assume you we all मोती की तरह हमको ये सारे points पता हैं. ठीक है, आगे बढ़ते हैं. Yeah, if the second time heart rate is less than 100, then what do you want to do? Can you answer me this question beautifully, please, Ahmed? Yes. Very good. Yes, if the second time heart rate is less than 100, okay, Shubham says adrenaline. नहीं ब्रो, शुभम एड्रेनलिन अभी यूज नहीं करेंगे. हार्ट रेट लेस देन 100 है ना ब्रो, एड्रेनलिन यूज. अहमद, वी विल नॉट डू एड्रेनलिन. इफ द हार्ट रेट इज लेस देन 100 वी विल डू वेंटिलेशन करेक्टिव स्टेप्स. Adrenaline, when are we going to use adrenaline? After 60 seconds. After 60 seconds of chest compression and bag and mass ventilation, the baby's heart rate is less than 60. Then you are going to use ADR. Are you understanding, my dear friends? Yes or no? बिल्कुल clear होना चाहिए ये, है ना? It should be very beautifully clear. That's why we always revise. Okay, so that हल्का भी doubt हो वो clear हो जाना चाहिए. मेरा पेंसिल नीचे गिर गई. कहाँ है? नीचे. जुकाम सा हो रहा है. डन. ओके, लेट्स मूव फर्दर. या अच्छा ये हो गया. ओके, लेट मी आस्क यू. ओके, डन. हाँ, okay, let me ask you some good question. This all we have done. Okay, done. This part is done. Yeah, this was the AIMS question. That is why I wanted to finish this topic one more time. Yeah. What is the SpO2 of a newborn at first minute of life? And what is the SpO2 of a newborn at 5 minutes of life? Exactly. Anyone? What is the best answer? Yes, beautiful. The first minute of life, the SpO2 of a newborn is 60 to 65%. Very, very beautiful answer. आपका कितना SpO2 होगा डॉक्टर शुभम? What will be your SpO2 if I put a SpO2 monitor? The answer is normally yes, 96 to 98%. Yes or no? The normal SpO2 of a baby will be not a baby, you baby will be 96 to 98%. The SpO2 of a newborn at first minute of life will be 60 to 65%. This much we should able to remember. And then after that we have second minute, third minute, fourth minute and fifth minute. So 5 you keep on increasing. Okay, 60 to 65, then 65 to 70, 70 to 75, 75 to 80 and 80 to 85. Dr. Shubhangi Kaushik has given a very beautiful answer. Yes, Shubhangi, तुमने बहुत अच्छा आंसर दिया था. पहले तुमने बहुत सही आंसर दे दिया था. So 80 to 85% is the best answer for the fifth minute of SpO2, and first minute of life it is 60 to 65%. That is also a very beautiful answer. And 10th minute of life. 10th minute of life, can anyone tell me what is the normal SpO2 of a newborn? So 10th minute, no, increase by 10. 10th minute you increase by 10. So 85 to 95%. 85 to 95% sounds a very beautiful answer. Okay, I hope we all are able to understand this. These all are very important questions. Okay. Okay. Yeah. Now, okay. Bag and mass ventilation. Can you please tell me what is the rate of bag and mass ventilation? Means normally in 1 minute कितनी बार करना होता है ये? How many times in a minute I must do bag and mass ventilation? Who will tell me? Yes, as everyone is right. Beautiful. Dr. Kavya, Durga, Sahil, Amrit, Metazillo. Hanji. So the normal RR of a newborn, respiratory rate of a newborn is 40 to 60, right? उतनी बार ही करना होता है जितना उसका बच्चे का RR है, उतनी बार ही हमको बैग एंड मास करना है, राइट? एंड व्हाट इज द रिकमेंडेड. कहाँ चला गया? हवा के झोंके से चला गया. तुझसे नाराज नहीं जिंदगी. Yes. So उसके बाद क्या एक कहाँ चला गया भैया, एक सेकंड. Yeah. So that's very important. Remember the rate is basically 40 to 60 cycles per minute. This is a good one. I'll give you a eclairs. If anyone can tell me very, this was a DNB question. Most of my students are DNB also who are attending my classes. Exactly. हाँ जी हाँ जी, अभी गाता हूँ भाई जान. ओके. हाँ. ओके. हम्म. Perfect. Hanji. So yeah. So what do you call, yeah. What is the recommended pressure at first breath? This is a very important question. Exactly. Hanji. Very, please remember, my dear friends, if the examiner has to make the paper very tough, then he will ask you this question, okay? That at first breath, जो pressure है, the ambu bag pressure, no. How much should I do? Yes, first breath, basically 40 centimeter of water, okay? Not mercury, brothers and sisters. Mercury, water, not mercury. 40 centimeter of water should be the first pressure, and subsequent breath pressure 40 ka half is 20. Roughly around 20 centimeter of water is the first one. Then also this was the DNB question. Then a neonate requires how much pressure of the first inflation? What do you think, my dear friends? ABCD? Exactly. So the answer is 25 centimeter of water. Exactly. B is the best answer. See, guys, hello everyone. That is how the questions come, okay? Imagine this question come. You have read the whole neonatal resuscitation protocol, लेकिन ये नहीं पढ़ा था. That एक bag and mass का first pressure should be how much? So the best answer is around, yeah. So yeah, 30 to 40, then half is 15 to 20. हाँ जी, ठीक है. This part is over. Okay. Okay. This also very strange question. See, if the examiner is if the examiner has fought with his wife, then he will ask you this question also. At what pressure pop-up valve is released? Do you know what is pop-up valve? Let me show you a picture. This one, dear. एक सेकंड देखो, ध्यान से देखो, ये वाला. Can we appreciate the yellow wala? एक second. अब I don't know how to zoom it, bro. This one, this one. Can we see? This yellow thing. Can we see that, bro? This is known as pop-up valve. क्या बोलते हैं इसको? Pop-up valve. Pop-up. There are various types of valve in bag and mask. We have the inlet valve. We have the fish mouth valve. We have the pop-up valve. जब हम ऐसे press, जब once we press, no, this thing once we press, no, there's ऐसे कुकर की सिट्टी की तरह आती है आवाज. Okay. So this thing basically goes like that. So the question is, how much pressure pop-up valve is released? Yes, exactly. Could you answer in the comment section? Yes, if the examiner has fought nicely with his wife, तो बेटा फिर देखो तुम्हारा पेपर, फिर भगवान ही मालिक है, भगवान भला करे. Exactly. Exactly. So ABCD. Any random guesses? The answer, Dr. Shubham, the answer is A. 30 to 40 centimeter of water. 30 to 40 centimeter of water. Pop-up valve. Okay, pop-up valve, the pressure which basically increase. The best answer is A. Pop-up valve is different, okay, and this one is different. This pressure is different roughly. This is this pressure. Once I put the pressure, right, and ऐसे जा रहा है, वो सेम ही है, अराउंड 30 to 40 सेंटीमीटर ऑफ वाटर. ओके, 30 to 40 सेंटीमीटर ऑफ वाटर. परफेक्ट. नेक्स्ट क्वेश्चन प्लीज. Over. Yeah, this was the important thing I wanted to tell you. Yeah, this was the NEET question. This came in the recent NEET paper, which is the most important step for successful resuscitation. Very nice question. Exactly. Osama कह रहा है पहले कोई मिले तो सही. Yes, bro, that's right. हाँ जी. Who will tell me which is the most important step of successful resuscitation? Anyone? What do you think? The answer for this question is ventilation. Ventilation is the most important step for the resuscitation. Okay. ये please star mark. This was a NEET PG question. Ventilation is the most important step in successful resuscitation. This part is over. Okay. This is another crazy question. Which is the most important indicator of successful positive pressure ventilation? Remember, this bag and mask ventilation only is known as positive pressure ventilation. Can anyone give a random guess कि मैंने बहुत अच्छा positive pressure ventilation दिया, which is the most important indicator of a successful PPV? डॉक्टर आनंद आपने बहुत अच्छा PPV दिया, उस कैसे पता चलेगा मैंने बहुत अच्छा PPV दिया? Rising heart rate, very important. Okay, wherever it is a star mark has already been an FMG and a NEET question. So two important questions we have covered. How do I know that I have given a successful bag and mass ventilation? Naturally, patient's heart rate should rise, right? If the heart rate was less than 100, I gave bag and mass, right? Then again, I checked the heart rate. Normally, it should increase by 100. Yes or no? अच्छा bag and mass करूँगा तो heart rate बढ़ेगा, right? So heart rate is a indicator of successful bag and mass ventilation. And what is the step for successful resuscitation? ये अपने आप ही लाल पीला हो गया. Ventilation is the most important step for successful resuscitation. Exactly. Done. Again, very important question. See, we are lucky, we are doing every single question. Once you attend my classes, you don't have to read any MCQ PG book. इसमें बहुत कुछ है, ठीक है? Which is the preferred method of obtaining emergency vascular access in delivery room? If I have to put a IV line in a baby, which IV line should I use? We read, no, the baby has not cried, I might have to give ADR, which is of course given intravenous, and also it can be given intratracheal. But the question is, if I have to give intravenous, which is the preferred method of obtaining emergency vascular access? Yes, the perfect line is umbilical line. Again, star mark, very important question. The best IV access in a case of what do you call this one? What do you call क्या कहते हैं उसको? In a neonatal resuscitation, the answer is umbilical line. Umbilical line. Perfect. Okay, what can we appreciate in this picture? Can anyone tell me in the comment section? Any random guesses? ये क्या है? मतलब this one, bro. What is this? If this X, ये लाइन, ये पाइप से क्या है ब्रो? पता नहीं क्या चीज है, कोई बता सकता है मेरे को? Yes, very good. हाँ, exactly. This only is the umbilical line, umbilical venous catheter or umbilical venous line. This is the umbilical line, my dear friends. Please remember. Kavya says nasogastric tube. Dear, nasogastric के लिए, you know, the pipe should be like this, like it should come like this. ये पाइप अगर होती ना, मैंने जो आर्टिफिशियल बनाई है, ये है nasogastric. This stomach, no, this is stomach, right? So this will be a nasogastric. ये जो नीचे से आ रही है ऊपर, this is not a nasogastric tube, it's an umbilical venous line. Remember, okay? Again, okay, great. Next question. What is a vigorous and a non-vigorous meconium stained baby? You know, right? Meconium, gynae people. Okay, yes, exactly. Gynae people says, Dr. Anand, we are doing LSCS for the mother. I'm asking, why are you doing LSCS for the mother? They will say, Dr. Anand, बच्चे ने ना माँ के पेट में potty कर दी है. Dr. Anand, baby has passed meconium in the mummy's tummy. Very beautiful question these are. Okay. Question number 1. How the gynecologists know that the baby has passed meconium? Who will tell? हाँ जी, आंसर बताओ मुझे पहले. My question is, gynae people are planning for cesarean because they told me, Dr. Anand, baby has passed meconium in the mummy's tummy. But the baby is in the mummy's tummy, no? How come gynae people सपना आया था रात को उनको? Did they get a dream that baby has passed meconium? How do they know? My question is that. Dr. Abhishek says, yes, exactly. By ultrasound. Ultrasound is not the right answer, dear. Ultrasound is not the right answer. Anything else? Okay. Dr. Williams says amniotic fluid. Amniotic fluid. How gynae people knows amniotic fluid? क्या उन्होंने झांक के देखा था? हाथ लगा के देखा था? कैसे ऐसे कैसे आ गया? ओके, डॉक्टर मनाली सेज देयर कुड बी रप्चर ऑफ मेम्ब्रेन या PROM, जिसको हम इन गायनी वी से PROM. हैव यू हर्ड ऑफ PROM? Premature rupture of membranes. Okay, one way I understood. Okay, one way I understand. Normally, what is the color of the liquor? What is the color of the liquor? The color of the liquor is usually colorless. It's पानी की तरह होता है. It's like transparent, bro, colorless, right? If naturally it is meconium stain, then it will be like a green color. Yes or no? Meconium is blackish green, no? So it will be like a greenish color like a. One point I agree with you. Gynae people did the per vaginal examination and they found that there was a premature rupture of membrane and the color of the liquor was not colorless. I agree with you. This is a good answer actually. Kisne diya ye answer? It's a good answer actually. Next question. There is no premature rupture of membrane. Still, the gynae people call me and tell Dr. Anand, we are planning for a cesarean section because the baby has passed meconium in the mummy's tummy. How? How gynae people knows that the baby has passed meconium? Ultrasound is not the right answer, and there is no PROM in this case. The answer is, what is the answer? Okay. Okay, what is the answer? Did you get my question, bro? Anji, Ritu, Dr. Bhargavi, Suman, Akanksha. Dr. Suman says heart rate was less than 100. How gynae people knows heart rate was less than 100? कैसे पता gynae वालों को कि बच्चे का heart rate less than 100 है? कैसे पता? Okay, Shubhangi says good muscle tone is vigorous. But dear Dr. Shubhangi, you're not answering my question. My question is, gynae people, the baby is in the mummy's tummy. माँ pregnant है, बच्चा माँ के पेट में है. कैसे पता gynae वालों को कि इस बच्चे ने माँ के पेट में potty कर दी है? समझ में आ रहा है question? Are you getting my question, guys? What is the answer? Anyone? Last 5 seconds. Any guesses? Are you getting my question, right? हाँ जी. Exactly. Dr. Shivani Pandey and Dr. Abhishek has the best answer. Have you heard of NST? What is NST? Non-stress test. Very important. Have you heard of non-stress test? Yes, that's right. NST is, yeah. Hanji, baby is in distress, heart rate will be low. NST करेंगे ना, you know what is right ना, it's a, you know what right, NST to a non-stress test, it's a 20 minutes electronic monitoring of the baby which has acceleration and decelerations. Have you heard of about NST, bro? So a non-stress test is the best answer. हाँ जी, okay, and the question now here is, yeah, इसके बाद next question आता है, what is a vigorous meconium stained baby and what is the non-vigorous meconium stained baby? The answer is vigorous meconium stained baby is heart rate more than 100, good muscle tone and good efforts. A baby who has born, a baby who has just born, जो meconium stained है, that baby is meconium stained, right? What is, how do you approach this baby? The answer is, sir, I will see whether the baby is a vigorous meconium stained baby or a non-vigorous meconium stained baby. What is a vigorous meconium stained baby? The answer is heart rate more than 100, good muscle tone and good efforts. मतलब बच्चा सही है, heart rate ठीक है, tone अच्छा वै normal baby cry like this, okay. Hypotonia, the baby will be totally down. Good tone, the baby will be he'll be crying like this. Good tone, right? That's what. So heart rate more than 100, good muscle tone and good efforts is a vigorous meconium stained baby, and opposite of that is non-vigorous meconium stained baby. Heart rate less than 100, decrease tone and decrease efforts. That's it. Okay, exactly. Hanji, Osama Sheikh is very right. Osama, Ahmed, Suman and our Shubham, perfect. Very good. Yes, done. Chalo. Part is over. Yes. Has everyone understood this much? Please put a like button to this video or a like button that you have understood what I have told you till now. Exactly. तो हम आगे बढ़े. ओके, ग्रेट. हाँ जी, चलो ये आगे बढ़ते हैं. शुरू करो अंताक्षरी, लेके प्रभु का नाम, कुछ करने के लिए बोलो राम राम राम. मेरे पे आया मुंह पे, मैं बोलता हूँ, ठीक है. Dr. Ahmed says, you are superb, give me hope. Yes, Dr. Ahmed, everything will be fine. And still, if I am not there in your life, make sure you are fine. There was a very beautiful saying, you will not always be motivated. You will not always be motivated. So you must learn to be disciplined. Very important. Okay, I want you guys, to reach a phase of life where you no longer need motivation. You are self-focused. You have a vision. You are yourself reading a lot of motivating quotes, motivating novels. What it called, I recommend everyone to read a lot of motivating novels. It will give you a different vision of life. Okay. Yeah. So that's what a very beautiful thing we say is, you will not always be motivated. Our classes will not always be there. You will get a PG seat, you will take MD pediatrics, derma, surgery, medicine, right? Whole life you will not study NEET, right? So you will not always be motivated. So you must learn to be disciplined. So if you are actually my true student, then come to a phase of life where you no longer need motivation. You are self motivating yourself. So that's what. Okay. And remember, believe in your dreams. Believe in your dreams. They were given to you for a reason. Believe in your dreams. They were given to you for a reason. Remember that. Okay. Like, one of my friend, he's a non-medical, so he's my best friend. So he was telling me that, Anand, how do you see this baby? Like, I was showing him some rare genetic anencephaly and neural tube defects baby. I used to take clinical videos. No, I used to show him. I was like, see, this baby, no, is having a craniorhexischisis. Like, he's having a neural tube defect. He's like, oh, I can't see this. You kya dikha diya? He's like, what did you show me? I can't see all that. So that's the funny part, like then I used to say him that, see, you can't see these things, right? But I can see. So that means there has to be someone, right, who can see those very weird conditions, congenital malformations, yes or no? So that's what, believe in your dreams. They were given to you for a reason. Being a doctor is the most beautiful job on this planet. You should be really proud of yourself. There are people, I have seen people, oh, I can't see this, why are you showing me this? Oh, I can't see that, like that. Then I used to think that, that if I behave like you, saying I also can't see this thing, okay, oh, what is this karke, then who will see? तो ट्रीट कौन करेगा फिर? तो गुरुजी आएंगे ट्रीट करने के लिए, भगवान राम ऊपर से पधारेंगे ट्रीट करने के लिए. भगवान राम ने हमको बना दिया, अब हमें ट्रीट करना है, राइट? डू यू एग्री विद दिस, yes or no? So I used to think, and I used to tell my friend, I was like, see, that's the difference, you can't see these things, and I treat these things on daily basis. I see 100 patients like that. So means I was given this job for a reason, right? I was given this thing for a reason. So that's what, believe in your dreams. They were given to you for a reason. Okay, let's move further. Part is over. Okay, let's move further. This done. Yeah, next question. Yeah, exactly. Perfect. Let's move further. Identify the device. Recent question 2018. Which device is this? Can anyone tell me? Dr. Bhargavi, Osama, Abhishek, Benedict, Sahil, Shubhangi, Ahmed, Manali. Okay, who is going where? Okay, yeah, okay, yeah. ओके, सो यस, द बेस्ट आंसर फॉर दिस क्वेश्चन, जो ये डिवाइस है, ये लेटेक्स जो जिसमें यूज नहीं होता, this is nothing but laryngeal mask airway. Like, I just want you guys to remember this one. Okay, it's a laryngeal mask airway. Okay, this is known as LMA, nothing but laryngeal mask airway. Okay, remember that. Perfect. This only, dear. See, देख पा रहे हैं आप? Okay, this one, laryngeal mask airway. Just this device as a photographic memory, you remember. This is a LMA, laryngeal mask airway. Okay, okay. I wanted to show you one more picture. One second. Yes. Yeah, this is a very good slide, my dear friends. Can you quickly please tell me what is this device? ये वाला क्या device है, bro? Exactly. Yes. This is nothing but, have you heard of, laryngoscope? Yes or no? Is this a laryngoscope? Exactly, this is a laryngoscope. In which hand you should hold the laryngoscope? In the left hand or in the right hand? Anyone? Left hand or right hand? Normally, if I have to intubate a baby, one hand I will hold the laryngoscope. And what is this one? What is this one? Of course, this is a endotracheal tube, right? Yes, exactly. Dr. Biswarupa Majumdar is very right. You hold it in a left hand. Normally, if you are a right-handed, or 90%, 99% cases, this device, the laryngoscope, you hold in the left hand. You open this device, और इसमें light है, यहाँ पे ना light होती है. This part has the light. You open the device, you hold it in the left hand. You hold it like a pen. In the next exam, if an examiner asks you, how do you hold a laryngoscope? Sir, I open it first I check for the illumination, whether this laryngoscope is working or not. I open it, I hold it in my left hand and I use it, I hold it like a pen. जैसे पेन को होल्ड करें सॉफ्ट, ऐसे मुट्ठी में पकड़ नहीं रखना है, ऐसे कोई भारी भरकम चीज नहीं है. It's just open and hold it like a pen. In the right hand I will have this one. What is this? This is nothing but endotracheal tube. अच्छा ये पाइप क्या है ब्रो? Can anyone please, Dr. Osama, Dr. Shubham, can you please tell me ये क्या है साथ में? ये क्या चीज हो रही है जो यहाँ पे मैंने कनेक्ट की है एक डिस्पोजेबल सिरिंज के साथ? Can anyone please tell me what is this pipe I have connected? I don't know what is this. Can anyone tell me please? Suman, Mani Prakash, Shubham, Suman. This is nothing but cuffed endotracheal tube. Very, very important, guys. Yes, you know, right? We have cuffed endotracheal tube. We have an uncuffed endotracheal tube. This pipe, which is definitely there and connected to the disposable syringe, this endotracheal tube is used in adult patients. Adult patient, the vocal cord, the trachea is very big. Okay, so you put the cuffed tube. Basically, it makes a seal. It makes a seal of the whole laryngeal area. Whereas a newborn baby, you don't need a cuffed endotracheal tube because newborn's larynx is very chotu, very small it is. Okay, that's it. Now, last question. What is this one? Already very beautifully Dr. Sahil has told. This is nothing but Goodell's airway. Goodell's airway. Okay, let me show you. This one. Can you tell me what is this, bro? Very quick answer. What is this? Or same thing, what is this? This only is nothing but Goodell's airway. Okay, this is nothing but Goodell's airway. Remember that. Okay, very good, very good, beautiful, very nice. Exactly, to prevent the displacement of the tongue, to prevent the aspirations, to prevent tongue falling back, to prevent sleep apnea and this and that. The patients who are ventilated, the patients who are comatose, it's very important. And also इसमें क्या होता है, suction डालते हैं. We put the suction pipe, you know this, can you see the hole, this hole? You put the suction because secretions are there, no? You suction like this. Okay, you just suction from the Goodell's airway, basically. That's it. Okay, exactly. Yeah, okay, next question. What is this device? So we are very lucky, we are studying all clinical questions. ये Philips company का कौन है ये? Can anyone please tell me what is this one, bro? Identify the instrument. The options are pulse oximeter, cardiac monitor, bilirubinometer and flux meter. Hanji, Suman, Shilpi, Sahil, Swaraj, Shivani and Metazillo. Hanji, this is nothing but the big one. Yeah, see, अच्छा ये क्या है? ये exactly, ये है pulse oximeter. This one is a pulse oximeter. Do you remember, my dear friends, during the COVID times, right? We always used to say everyone must have a pulse oximeter. Do you remember? Yes or no? I hope you all guys must be having pulse oximeter at home. I have 3 pulse oximeters at home. और तीनों की battery cell down है उन तीनों के, क्योंकि use अब कम हो रहे हैं. In the era of COVID, we always used to say please have the pulse oximeter at your home, and saturation less than 90% or 90% touching must visit the physician. This is pulse oximeter, and this one is the this is the cardiac monitor. पूरा जिसमें ECG leads, this, that, everything comes. No, this is the cardiac monitor. This is the pulse oximeter, and this one, what is this, guys? ये क्या है? तो ये 11.5 दिखा रहा है Neobil company का. क्या है ये, bro? What do you call this? Can anyone tell me? याशिका क्या कह रही है? एक मिनट. Pulse oxy, COVID की जान. yes, Dr. Yashika, you're very, very right. Dr. Suman says during COVID it became our pocket articles. Same this side. Yes, this is nothing but bilirubinometer. This is nothing but infrared. Very beautiful, this one. Okay, infrared. I was thinking one thing also, like in my hospital we do a lot of case like paper presentations and case reports. Anyone applying for USMLE, MRCPCH or any what you call abroad countries exam, you must have some publications in your name. So anyone wants to do any publications, let me know. Like, of course, because I help a lot of students, we have our medical college, we share good knowledge, and many students do hard work and we publish papers, तो उनका नाम वहाँ पे आ जाता है. So it is good, it is a mandatory thing if you're applying for abroad exams. So let me know. Okay, so this one is nothing but why I was ये क्यों मेरे जहन में अभी आया, because there was one student in my final year MBBS in my medical college. He was preparing an article of infrared bilirubinometer. This is infrared. It was a very beautiful article that, for taking the serum bilirubin levels, you have to take the blood sample. Yes or no? If the baby has a high jaundice, no. Every 6 to 8 hourly, you have to take the serum bilirubin levels, no, because you have to see whether the baby is landing up into carnivorous, whether the baby has conjugated or unconjugated hyperbil, or landing up into some syndrome. Are you understanding what I'm trying to tell you? So the moral of the story is, to avoid multiple pricks, this infrared bilirubinometer is very nice thing, right? It's a very nice thing. बस ऐसे करो और आ जाता है करके. You do like this, like a temperature check, no, like an infrared temperature check. We have this infrared bilirubinometer. Okay, so this article, the student was doing one paper presentation, case report on that international research. He was doing it. So that's what, to avoid the multiple pricks in the baby, how well we can use the infrared bilirubinometer. But there were some drawbacks in that. The drawbacks was, the first drawback of this bilirubinometer is, number one, the price. Can anyone guess the price of this machine? Can anyone please tell me, what do you think? Hanji, Dr. Bhargavi says, which type of bilirubin it will detect? Both only, conjugated plus unconjugated, direct, indirect, both it will detect. Okay, Hanji, what is the price of this machine? Can anyone tell me? This price of this machine starts from 1 lakh. 1 lakh से start होती है इस machine का price. So this machine basically is there in our, like a private corporate level for tertiary multi-speciality hospitals. We have this machine, but in our government setup, we can't afford this lakhs of machine for one small thing. If you do it online, हाँ जी exactly, तो proper जो आता है डॉक्टर साहिल 1 लाख से ऊपर का, 10,000 का नहीं आता, वो 10,000 वाला बड़ा वो है, अच्छा वाला नहीं है. जो प्रॉपर आता है वो लाख सवा लाख का आता है. So there was one drawback. This is very expensive machine. The second drawback was, it can only detect to some levels. It can only detect the serum bilirubin to some levels. For example, a baby having serum bilirubin 28, 35. No, what is the normal serum bilirubin in a newborn? Anyone? In a newborn term baby, what is the normal rough serum bilirubin levels? What do you think, guys? Anyone? Yes. In a term baby, 2.5 to 4 kg healthy हट्टा कट्टा बच्चा, मोटा मोटा मान के चलो less than 12 in a term healthy baby. Normally serum bilirubin depends on day of life, hour of life, prematurity, maturity, weeks of gestation, multiple things. But on a very rough scale, healthy looking baby, mother coming and showing you some serum bill report, less than 12, we say it is okay, nothing to worry. So any baby having 18, 28, 35, very high hyperbilirubinemia, you cannot detect from this infrared bilirubinometer. So two drawbacks. Number one is the price. Second is the this one, what you call high bilirubin can't detect. Okay, that's what you should know. Okay, हाँ जी. Okay, ठीक है. खत्म करें या पढ़ना है 5 मिनट और? 2 minutes more we will study. When will be the umbilical cord fall? We have done this question previously, right? When will be the umbilical cord fall? As everyone knows, 5 to 7 days of life, roughly by 1 week of life, this umbilical cord should fall off, right? And how many veins umbilical cord has? Exactly, everyone knows about it, right? We have 2 arteries and 1 vein, right? 2 arteries and 1 vein, 2 arteries and 1 vein. And very old question, if a baby has a 1 artery and 1 vein, what will you think of? Exactly, you will think of renal agenesis. उस बच्चे का किडनी नहीं बना है बोल के. Renal agenesis you will think of if a baby has a 1 artery and 1 vein, right? This part is over. Yeah. Okay, fine. Last question, then this class is over. 50 मिनट हो गए हैं. थकता नहीं है कोई? सॉरी, कोई थकता नहीं क्लासेस में? 50 मिनट हो गए हैं, और पढ़ाओ, और पढ़ेंगे. 50 मिनट बहुत होते हैं. बंदा ऐसे पागल हो गया, बंदा भागते फिरे कि वो बहुत देर होगी, अब तो बस ही कर जाओ करके. हाँ जी. एक्सेस ऑफ विटामिन के, अगर बहुत ज़्यादा विटामिन के मैंने दे दिया, तो normally how much vitamin K do we give to the newborn? We know that normally if the baby is more than 1 kg, then 1 milligram vitamin K is fair enough. If the baby is less than 1 kg, then 0.5 milligram vitamin K is more than enough. Okay, remember that. Yes, exactly. हाँ जी, तो बता दे मुझे कोई exact. Dr. Rao says positive energy from you. Thank you so much, dear. Okay, हाँ जी. Excess of vitamin K, what is the best answer for this question? It can cause jaundice. Excess of vitamin K can cause hyperbilirubinemia. Just remember this one line: excess of vitamin K usually causes हाइपर बिलिरुबिनीमिया। एग्जैक्टली, डॉक्टर सुमन सेज आपकी क्लास में 2 घंटे भी कम लगते हैं। Thank you. Dr. Biswarupa Majumdar says, sir, your teaching style is too good. Thank you so much, dear. Thank you. That's very kind of you. बस काफ़ी है इतना, और आगे पढ़ें। हाँ, वेरी ब्यूटीफुल पिक्चर गाइस, फोटोग्राफिक मेमोरी, फोटोग्राफिक मेमोरी। एक्चुअली हीमोलाइसिस बहुत ज़्यादा हो जाता है अन्वेषा व्हेन देयर इज टू मच ऑफ विटामिन के। नो, it causes too much of hemolysis, and too much of hemolysis will cause jaundice. It's a side effect of too much of vitamin K. Why? It's like too much inside mutations and this and that. That is not required for us. Okay, very important guys. Very classical picture. Can we please appreciate over here 2 artery and 1 vein? Can we here appreciate 1 artery and 1 vein? Can you please tell me which one is artery, which one is vein? If I say this is A, what is this? Is this the artery or is this the vein? अगर ये question आ जाए dear, ये कौन है ये? Is this the artery? Is this the vein? Dr. Metazillo says, sir, please explain delayed cord clamping in the tonight's 11 p.m. class, my dear. This one, the next topic is that only actually. अच्छा, तो MCQs भी आएंगे बहुत सारे, और this only. The tonight 11 p.m. class, the topic is delayed cord clamping. The Q2 pi is there. This is the heart-shaped umbilical cord, and this is the placenta. Delayed cord clamping. Should we do? Should we not do? In the next 11 p.m. class, we're going to talk about positive and negative effects of delayed cord clamping. वो हम 11 बजे करेंगे। अब और उससे पहले MCQs, और उससे पहले ये वाला। हाँ जी, बताओ जल्दी से भैया, which one is artery, which one is vein? So can I write collapse lumen? Okay, if they ask you in the anatomy image based question, ये जो खुला हुआ होता है ना, हमेशा vein होती है. The blood oozing out will be a vein. If this is the artery and this is the vein, okay, the collapse lumen is the vein, the bigger diameter is the vein, the blood oozing out will be the vein, so that's why this one is the vein and this one is the artery. ठीक है? That finishes today's class. Thank you so much everyone for this wonderful participation. 55 minutes are enough to study one topic. Has everyone understood this much? Please put a like button to this video or the last like button to this in the comment section. समझ में आ रहा है या नहीं समझ में आ रहा? डॉक्टर राव says hemorrhagic disease of newborn details में, हाँ जी आगे आएगा डियर, आगे बहुत कुछ आने वाला है. Dr. Rao, we have so many things coming in further. Neonatal jaundice, neonatal, so many sepsis, cephal hematoma, caput secretarium, so many stuff. IUGRs, type, diagnosis, this, that, बहुत कुछ है. So chill. कुछ रह जाएगा तो मुझे बताना फिर. That finishes today's class. Thank you so much everyone for this wonderful participation. Before leaving, we always have a motivating quote. And today's motivating quote is, don't stress the could haves. If it should have, it would have. Don't stress the could haves. Okay, I wish I could have done better. I wish last exam could have been easier. I wish I had a best friend. I wish I had a very beautiful girlfriend. I wish my parents were more supportive. I wish my best friend can understand me. I wish I had 3 best friends. I wish I had a huge group of circles of good friends. Don't stress the could haves. If it should have, it would have. अगर होना चाहिए होता तो हो जाता. It is as simple as that. ये हो सकता था, काश वो हो सकता था, उसकी जरूरत नहीं है. ग्रो अप, ग्रो. आई वॉन्ट यू आर ऑल गाइज टू ग्रो. जिंदगी बहुत तेज बढ़ रही है, कंपटीशन बहुत ज्यादा है, so try to be stay happy, try to be positive, try to be beautiful, try to grow, be mature, be wise, be amazing. Choose your happiness, you choose positivity. Okay, we always say that positivity is a choice. No, I only have all the struggle, God has given me all the struggle. Sir, you have no idea how much struggleful my life has been. We all have struggles, we all have up and downs. Okay, so don't do all that. So try to be stay positive. The thought process is positivity is a choice. Okay, don't stress the could haves. If it should have, it would have. काश ये हो सकता, काश वो हो सकता, काश ऐसा हो सकता, काश वैसा हो सकता, काश कोविड ना होता, काश मेरा यूएस का वीजा लग जाता, काश पढ़ाई थोड़ी आसान होती, काश कोटा सिस्टम ना होता. तो होने को तो बहुत कुछ नहीं हो सकता. इफ इट शुड हैव, इट वुड हैव. अगर होना चाहिए होता तो हो जाता. सो मोरल ऑफ द स्टोरी इज व्हाट? The moral of the story is acceptance is the key. acceptance is the key. Accept your present, accept the way you are, and accept whatever happening in your life, because the time you accept it, you might as well as embrace it. आप पहले accept करेंगे, फिर appreciate करेंगे. accept ही नहीं करेंगे तो appreciate कैसे करेंगे? ओके डॉक्टर, अच्छा अच्छा, शुभम कह रहे हैं हिंदी, हिंदी में बोलूंगा तो फिर कमेंट आएगा इंग्लिश प्लीज, नो हिंदी अंडरस्टैंडिंग. एग्जैक्टली. सो हाँ जी, सो एग्जैक्टली. Yeah, exactly. So tonight, see you tonight at 11 p.m. 30 minutes quick class on the Unacademy app, where we're gonna talk about delayed cord clamping. And Dr. Osama also has a very beautiful quote. He says, "People will throw stones at you. People will throw stones at you. Don't throw them back. Collect them all and build an empire out of it." That's very well put. ठीक है, collect them all and build an empire of it. Okay, and very beautiful. अभी मैंने quote डाला था, people who hate me motivate me. Okay, people who hate me motivate me. जो लोग आपकी निंदा करते हैं वो आपको बहुत ही अच्छे तरीके से अप्रिशिएट कर सकते हैं एक्चुअली. पीपल हु डिसरिगार्ड यू और कमेंट ऑन यू, they can motivate you in a very nice way. Okay, so like, you decide what is your life. Okay, don't let anyone else decide on your behalf. You decide how you want to behave. You decide how you want to take someone else's comment. You want to take it in a very abusive way, you want to punch that person back, you want to take it in a very negative way, you want to go home and cry, or you want to say that I will be a better version. I don't care what they say, but I have my own journey. I have my own vision. I have my own journey. You कहते हैं, there was a recent quote. I read a lot of motivating quotes actually. There was a recent quote, be busy, be so busy that you don't have time to listen to critics. Okay, be so busy that you don't have time to listen to, he was saying that about you, she was saying that about you. You say, Baba, I have a different vision altogether. I have a BMW Grand Limousine. I have to buy 2 CR apartment in Leela Apartments in the top floor with penthouse with swimming pool and pool and snooker. So I don't have time to listen to your negative part. I am very busy in making my own empire, right? अच्छा ठीक है. अयो song exactly, yeah. Yeah, that's right. Okay, song. अच्छा ठीक है. Okay, just one line, any song. Okay, पुराने गाने आते हैं मुझे, ये बड़ी बीमारी है. ओसामा बोलेगा न्यू सॉन्ग्स प्लीज, नो ओल्ड सॉन्ग्स. ठीक है. ठीक है. दिल की डाली पे कलियां सी खिलने लगी, जब निगाहें निगाहों से मिलने लगी. दिल की डाली पे कलियां सी खिलने लगी, जब निगाहें निगाहों से मिलने लगी. एक दिन जिंदगी इतनी होगी हंसी, झूमेगा आसमां, गाएगी ये जमीन. मैंने सोचा न था एक दिन आप यूं हमको मिल जाएंगे, फूल ही फूल राहों में खिल जाएंगे. मैंने सोचा न था. Thank you everyone for this wonderful participation. Please take care of yourself. Life is just one. Chill, enjoy and breathe, and see you tonight at 11 p.m. on the Unacademy class.